Hello everyone, and a warm welcome to our August newsletter in which we provide a brief update of some of the health awareness subjects this month. My name is Sabine, I'm the Community Engagement Officer, and I'm joined by Hayley this month. Welcome Hayley.
Thank you.
Hayley is our social worker, and I'm also joined by Amanda, who will be highlighting some of the health promotion subjects at the end of this video. Welcome Hayley, thank you very much for joining me this month. Can you please tell us a little bit about yourself and your role here at TDHS?
Sure. So hi Sabine, hi everyone. Thank you for asking me to be a part of this month's newsletter. My name is Hayley and I am the social worker here at Timboon and District Healthcare Service.
Great. When did you start, Hayley?
I started in about September last year, so I've been here for roughly almost 12 months now, which is great. Yeah.
It's going quickly, isn't it?
Yeah, absolutely it has.
And as a social worker, you would be faced with quite a few of the health awareness subjects that are actually in August being highlighted. And one of the subjects is Homeless Awareness Week, and the theme is Everybody Needs a Home. Now, when you go into Melbourne, I haven't been to Melbourne for a while because of COVID, but when you go into Melbourne, you're confronted with it everywhere. It's not that obvious around here, but there's still homelessness around, isn't there?
Yeah, absolutely. I think homelessness is a topic that a lot of people find quite uneasy. And in our communities, it's often out of sight, out of mind. And like you've touched on, in rural communities, homelessness is less obvious. However, there are hundreds of women, men and children who in our district that sleep rough or on someone's couch each night. Unfortunately, emergency accommodation and homelessness services are often overwhelmed by demand, particularly in rural areas. So if you're needing assistance or you know of somebody who does, you can make an appointment with me to discuss your options further, or you can contact the homelessness service in Warrnambool, Salvo Connect, directly.
That's great to know. Yeah, like I said, I just had no idea when I saw some of the figures, how much there is around here. So that's good for people to know they've got at least somewhere to go to and start the journey. This week is also about OCD and anxiety disorder. They are related, but they're also very different, aren't they?
Yeah, absolutely. So there are many types of anxiety disorders, and these disorders differ by the types of situations or the things that the person feels most anxious about, and also by the beliefs that exacerbate their anxiety. So anxiety disorders actually affect about 15% of Australians aged 16 to 85 in any given year, and they're more common in females than in men. Anxiety disorders also co-occur really commonly with other mental health illnesses.
Yeah, okay. I've suffered from panic attacks myself related to anxiety, so I know how overwhelming and scared it can be. But it can be tough to cope. But with the right support, things can get better, can't they, Hayley?
Absolutely. And there are three main treatments for anxiety disorders, including psychological therapies, medical therapies, and complementary therapies and lifestyle changes. If you're concerned about anxiety or want to speak to somebody about anxiety, you can see your GP, a psychologist, a mental health nurse, a counsellor. Even there's now mental health trained occupational therapists. Okay. Or of course you can see a social worker like me. Yep.
Again, that's great to know that you've got somewhere to, because it's just finding that coping mechanism as well to deal with, isn't it, Hayley?
Absolutely, absolutely.
Now, another serious subject calling for awareness is Dying to Know Day, which is on August the 8th. It is an initiative to destigmatise the topic of dying and educate others on how to die in a way that stays true to themselves and their wishes. And dying is something, I guess, that we try to avoid, but we must accept and plan so that we can live even better in the present moment, don't we, Hayley?
Yeah, absolutely. So in Western culture, we tend to have somewhat of a complicated relationship with death and dying. Yeah. And Dying to Know Day is all about encouraging people to start having a conversation. Unfortunately, death is one guarantee that we have in this world, and no one seems to have been able to escape it yet. No. And it is common for people to be afraid or find the conversation too difficult. By bringing awareness to death and dying and trying to further normalise it, the hope is that people will become more comfortable with and open to talking about death and dying. When we're more open to talking about death and dying, we open ourselves up to being more knowledgeable about our choices and our options at end of life. We can also decrease the stress and the fear felt on an individual level, but also for an individual's family or their close inner circle as well. So it's really an important conversation to have a think about and try not to be so scared and overwhelmed. Start small, start simple, and then hopefully that'll open up a bigger conversation.
Yeah, no, that's great to know. It's just that peace of mind as well, I guess, that, like you're saying, not having to have that stress for yourself and the family.
Yeah.
That makes it easier then to, I guess you have to then live the day to the fullest. And
yeah, you have the conversation, you've had the conversation, then you can put it on the back burner and you can go back to day and living your best life, like you've said.
Yeah, great. That's great to know. Thank you very much, Hayley, for highlighting some of the health awareness events. I know they were a little bit serious, but they are part of life, and they need to be talked about. So thank you very much for helping me doing that.
No worries.
If anyone needs any support in any way, how can they contact you, Hayley?
Yeah, absolutely. So I'm only here on a Tuesday, unfortunately, in Timboon. However, if you want to get in touch or make an appointment, you can call the reception here at TDHS 5 days a week. I think the girls are here and they will leave a message for me to get back to you or make an appointment. So either of those options.
Yeah, and it's the same in the weekends. Our phones go through to the nursing staff if admin staff is not there. So reach out and make an appointment. Or there's, of course, always the other organisations like Lifeline and all those that can help you and have a chat to you as well. Thanks again, Hayley, for highlighting these important health awareness subjects with me. And I'm now handing over to Amanda to talk about some of the health promotion topics for this month. Hi, Amanda.
Okay, well, I probably sound like a broken record. Every throw is always regarding COVID vaccinations, flu vaccinations, staying healthy. But COVID vaccinations are safe, effective, and they are actually free. They're available at the Timboon Clinic by appointment for all ages after a consult with the doctor. 555 86 088 is the number you need to call. You just need to be mindful of those around you. Stay safe yourself and look after those around you. Other things to be mindful of at this time is also wearing your mask when it's appropriate, keeping that safe distance, washing hands, hand hygiene is highly important, just basics of keeping safe and well. Flu injections are still available at the Timboon Clinic, also by appointment. I've also been out in the community for the last couple of months doing lots of businesses, all their employees. So those businesses have seen fit to actually pay for the flu vaccine for their actual employees to keep them safe. All of the vaccines are actually registered on the Australian Immunisation Register as well, so you can access your immunisation status through the MyGov Medicare site. Some other things that I've been actually doing or trying to plan is some back school activities. It's a bit hard at the moment, like everybody, trying to plan, also planning for postponements, but hopefully we'll get back on track with that. Some things haven't changed, and that's our screening programs, whether that's bowel screen, breast screen and cervical screening here at the health service. They have not stopped. They are considered an essential service, and an appointment for your cervical screen through the Well Women's Clinic can be made by phoning 555 86 000. So it's important to keep looking after yourself. I think screening, it has been found that screening rates are well down due to the pandemic. People have other things on their minds, but maybe the things that screening picks up can be attended to without much hoo-ha. but if you leave it and you don't get screened, it may not be a good outcome. So that's probably all from me. So remember what Sabine always says, stay safe and be kind.
Thanks, Amanda. Yeah, very important health promotion activities. Even though some things have been on hold, we're still working close with the businesses and the schools within the community. It just shows, Amanda shows that our body is an indispensable vehicle for experiences, but we often take it for granted, and we have to look after it so we can look after each other. And I just want to say again, we've had Kind July, but why should we stop in July? Why is it connected to a month? Let's just keep on going with Kind July and stay kind to yourself and each other. The community has showed its kindness by donating to our annual appeal, which has been fantastic. We have surpassed the 43,000 mark, and that is fantastic. That's so much more than we did in previous years. So thank you so much to the community for that. And it is very greatly appreciated, and we'll keep the community informed about how we're going. So as always, please look after yourself and each other, and together we can keep Timboon and our district safe and open. So please stay safe, stay apart and stay kind, working together for a healthy community. Thank you. Thank you, Amanda.
Thanks, Sabine.
And thanks to Hayley as well for assisting me in highlighting August month with health awareness. Thank you.